Welcome to the Let's Talk Facebook live show, episode 22. I'm Dr. Narissa Bauer, your host. I'm a behavioral pediatrician and blogger of Let's Talk Kids Health. As you know, the concept of this show is to share information about behavioral health, family wellness for children and families everywhere. Each week, I plan to bring you topics and guests to help me advance this mission so that we can all talk together. Now, remember, if you're viewing this live, you'll have the opportunity to post comments and ask questions of my guest. And let us know that you're here anytime by dropping a comment, saying hello, and using that hashtag live. The replay will be immediately available when we end this broadcast. So if you're watching and you're like, hey, somebody could really benefit from this, please share. Sharing is caring. And if you don't want to miss future episodes or maybe check out the past ones, please subscribe to my YouTube channel, Narissa Bauer MD, and follow my blog Facebook page, Let's Talk Kids Health. Okay, so now to this week's guest. Let's welcome Dr. Risa Davidson. Dr. Davidson is a board-certified pediatrician who has lived in Indianapolis most of her life. The only time she left was during her 4 years of medical school in Kentucky, and then she found her way back to Indianapolis to complete her residency at Riley Children's Hospital in 2009. She used to work for two larger hospital networks over the following 9 years, and then recently opted to leave the large corporation world to open her own direct primary care pediatric office in Carmel, Indiana. So let's welcome Dr. Davidson and learn what the heck is direct primary care for pediatrics. Hello.
Hello. Thanks for having me.
Yes, I am so excited. Now, I'm just going to share on this show that we're personally friends. I know you. We met at Riley,
Mhm.
and I have been watching you in your career and very excited that you have taken this leap. And I don't know how many people know about this model, but I just was like, we have to get her on so that more people understand what this is, because I think this is kind of a new thing, but there are more and
Yeah.
more practices and more doctors opting to go this way. So,
Yes.
but before we go into that, I wanted to just like say hello and ask you, like, please share something about yourself and what drove you to the field of pediatrics in the first place.
Yes. So, yes, like you said, we go way back. You were my attending back in behavioral pediatrics,
Uh,
developmental peds at Riley, which was wonderful. So peds, I was in medical school and I think doing my rotations, and I loved OB and I loved pediatrics. Those were the two that I really liked a lot, and I knew I wanted to do one of them. But I noticed whenever a baby was delivered with OB, I just was like, I just want to follow the baby. I don't really want, I'm done with the mom. Now let me go take care of the baby. So then I realized, okay, pediatrics is where I need to be. And I just love kids. And I feel like I'm still a kid myself. I definitely act like a kid. I read all the kids' books. Like, I feel like such a teenager sometimes. I'm very into like Harry Potter and Twilight and Percy Jackson, like all like the tween stuff. It's right up my alley. So I definitely relate to the kids a lot. So I think it works.
Yeah,
It's
it
good.
does. Yeah, it's good. And
It's a good fit.
I love that because you've got to be able to relate to the kids and talk to them about, what's the newest thing. So,
Yes.
I love that. Well, so, let's just jump right in because I think there's going to be some questions. I know I had questions actually because I didn't know much about this. So, what
Mm-hmm.
is direct primary care and how is it different from that traditional pediatric practice?
Yeah, so direct primary care, it's a membership-based model. So you basically pay the physician directly and you do it on a monthly, a quarterly, or like an annual basis rather than going through an insurance provider. So the insurance is cut out in a way. It's not really a new concept though. If you think about it back to at least when I was a kid and my pediatrician, you could just pick up the phone and you would call the doctor and the doctor would be there for you. There wasn't a whole system you had to work through. So it really is just getting back to that model of the physician relationship with the families and the parents and the kids, and that being a close relationship. It gives the doctor time to focus on the patient and also not having to focus on the coding. and the billing and the note writing. And physicians watching this know we spend a lot of time writing notes and making sure what's in the note works for an insurance company to approve something. Like we have to be very careful about what we write and how we write it and make sure it meets all the criteria for certain things. And that is very time consuming. It's very challenging because it's constantly changing as well. So patients probably don't know that, but a lot of a doctor's time is spent doing paperwork and non-medicine things, a lot of times trying to just deal with insurance stuff. So it's different in that aspect. And as far as how other things, how it's different from a peds practice, I think that was the second part of the question, right? Like a traditional practice. Obviously, the number one thing is that insurance has been removed from the picture. So it helps get rid of the red tape that you feel a lot of restrictions with certain things. So an example would be a lot of times, and a lot of families know, like you have to do a well check either. Some insurance companies allow like one time per calendar year, and some it's like, okay, it has to be 366 days. And it's very specific about when you can go in for that annual exam, which can cause a lot of issues when you're dealing with sports physicals and trying to work with parents' schedules and summer breaks and things like that. So it's just like little annoying things like that, which can be troublesome that we don't have to worry about in the direct primary care world. Also, typically you get one well check per year. I personally think it's nice to check in multiple times per year. It's hard to discuss, as you would know, like a lot of issues when you have, sorry, something popped up on my computer. It's hard to discuss everything at one visit. It's like parents wait until they know this annual visit's coming up and they come in with a list of like 15 things they want to discuss. And it's like, you could have reached out to me sooner and we could have talked about it. But a lot of parents are like, no, I wanted to wait until the checkup. I don't want to pay the copay, something like that. So it's nice that we can just be able to check in periodically with that. Also, with direct primary care and how it's different, I feel like the physicians are working for themselves again. And in turn, they are working to put the patients first, their needs first. So it's different in that instead of, typically in a practice, you would see like 20 to 30 patients in a day. That's pretty standard. And you get about 15 minutes per patient. This isn't a traditional like pediatric practice. Now, behavioral health, obviously you get more time. But in a general peds, usually you're looking at 15 to 20 minutes per patient to try and cover everything. And it's just back to back, which is very difficult. So with the direct primary care model, my patients are scheduled, they get like 60 minutes. I schedule a handful a day. I definitely can go over that time limit. I can go under that time limit. I just have time to give them because I'm not dealing with that mass volume of patients. The volume, again, it's so different. You're not going to see a direct primary care physician with a panel size. And by panel, I mean like how many patients are under that doctor's name, however many we have to care for. In direct primary care, it's going to vary practice to practice. Pediatrics is different than family medicine. A peds DPC doc, DPC is what we say, direct primary care. I'm going to abbreviate. It's easier to say. So a DPC pediatrician might have anywhere from like 200, I don't know, maybe to like 400 or a little bit more patients. My personal goal, 200 patients in this practice, and that's it. I don't want any more than that. I don't want to feel a little crazy. But other practices, family docs, I think they have a little bit more, maybe up to like 600. Just to put it into perspective, in the larger corporation where I used to work and where most of my friends and my colleagues still work, our panel size is close to 2,000 patients or more. And that's a big difference. That's a lot of patients to take care of, but that's the expectation when you're working in that big system. That's kind of what you have to do. So I would say those are probably like the biggest differences. I talked a lot there. I'm sorry.
No.
It's a lot of It's a lot of talking by me.
No. But clearly you are passionate about this because I think when we go into medicine and especially pediatrics, because compared to other medical specialties, we don't really make as much as other physicians, right? But we
Right.
all go in with that idea that we want to help the people we want to serve, right?
Yes.
And you mentioned just the red tape, all the documentation, all the other back end stuff with
Yes.
insurance and all of that billing, coding, that just takes up a lot of time. And it
Hmm.
takes away from your ability to just focus on the patient.
Yes, it really does. So, I mean, now I think the biggest question I get is like, yeah, about insurance, and the people really just don't understand the part about we just don't process insurance at all.
Yeah,
The only time we utilize insurance is for childhood vaccinations, which is processed through the insurance company if they have insurance.
yeah.
But otherwise, I don't process it at all. So there's just none of the billing and none of the coding. Like I write a note, and the note is for the patient, and the note is for me, and it's not for an insurance company or a business person to read it and make a decision about my care.
Mm.
So it's nice, and we all, at least when I was younger and I thought about when I'm a doctor, when I'm older and I want to be a doctor, this is how I want to practice. I imagined myself how my pediatrician was, and he knew our family, and I felt like my mom and my dad had a great relationship with the pediatrician, and it was just like we didn't live in a small town, but I felt like it was a small town feel, and I wanted that. I want to know my patients. I want to know about their families. I want to know what they do. I want to know about their vacations. I like to talk to them. I like to talk, clearly. So I just wanted that. And when I got out in the world and was having to see people every 15 minutes, it was constantly looking at my watch. Okay, I have to get to the next room. I have to get to the next room. And I don't like to run late. I'm very type A. I'm very on time. And so that was a struggle.
Yeah.
Because I had to stay on time. That was just like an OCD thing with me.
Well, and I have a very deep appreciation for our colleagues and friends that do general pediatrics. I
Yes.
mean, it is high volume,
Mm-hmm.
and you can be asked anything.
Yes.
And especially for what I do day to day, behavioral pediatrics, where I see
Yes.
families with ADHD, anxiety, depression, parenting problems, you can't really unpack that in the 15 minutes and give
No.
that the justice it needs or the time. It's really
Yeah, and
hard.
you never know when it's coming either. That's the hardest thing is you just never know what the family's going to present with, and it might be something very serious that you need an hour for, and it's almost like when a patient doesn't show up for an appointment or the next one, yeah, is late, you're like, oh my gosh, that's so amazing. I actually got to spend an extra 10 minutes with this person. Like it was sad, but it was a blessing when that happened, because some people you just need an hour with, but you can't predict that. You never know what's walking in the door
Yeah.
out there. So I mean, I did it for so long, and it was hard, and the burnout is real for sure. And it's not
Yes.
the patients. The patients are wonderful. It's just
Hmm.
everything surrounding it.
Yes.
It's hard.
Yeah.
Yeah.
And I appreciate that very much because I don't know about you, but I experienced burnout, and obviously I was
Hmm.
not in that same situation as you are. But I think that is a trend, and it's a very sad trend that I've seen
Yeah.
among my physician colleagues that are really great doctors, but yet are
Yeah.
really burning out.
Yeah. I mean, I'm 38 and I was burned out, and I was like, this isn't right. I'm 38 years old. I feel like I'm young. I'm a pediatrician, number two, which also doesn't make sense. Pediatricians were like the happiest people. And I was like, how am I burned out? Like, this is crazy. It just didn't make sense. So you just had to take a step back and look at everything and be like, I want to get up and be happy about going to work and enjoying my patients again. And just so I had to make a change. So I
Yeah.
took a major, major leap.
I mean,
It
major.
was big. There are only, so in Indiana, there's only two of us right now, pediatricians who do this. There's one up in Culver, and then there's me. There are
Wow.
a couple other DPC practices, family medicine, but there are no other pediatricians. So it's wild. I'm trying to be a
Wow.
trailblazer here.
You are a trail. That's what I was just going to say. You are a trailblazer.
Trying to help people.
And yeah, and the fact that, they don't really teach this in medical school, right?
No, no, not at all. We don't know any business that is not taught, and this is a lot of business. So I am thankful for my business husband
Yeah.
who has taught me a lot.
Yes.
Yes.
Yes. Well, kudos to you for taking that leap.
Thanks.
So, I want to circle back around to what you
Mhm.
said with the DPC membership. Now, if people who are watching this, listening to this, and they're like, "Huh, you've got me intrigued." So,
Yeah.
what
What do I
I mean, like, yeah, like
get?
what does that mean? Like, what is a membership and
Yeah.
like what does that entail?
I know, I didn't really talk about it, did I? So, so a membership, it's like a gym membership. So you would pay a monthly fee, like the first of every month, you just pay a flat fee. And that includes everything, which is really hard for people to understand and process. It's complete access to your physician. So my patients here have 24/7 access to me. So there's a patient only phone number and it rings to my cell phone. And so if there's a problem, they get me. There's not a nurse triage at night. There's no paging system. It just comes to me. They can text me directly. We can video message directly. So it's, direct access to your physician is huge. That's a huge part of it. No copays. So if you come in for 5 sick visits in a month, you got the kid with the ear infection and getting worse 2 days later, it needs to come back, or whatever it is. Any number of camp physicals, sports physicals, well visits, anything. There is no added fee for that. You're not going to get a bill from my office 6 months later for something that we did. Like, there are zero hidden fees at all. Everything is completely all inclusive. The other thing I mentioned earlier about, you don't have to save all your questions. If you have a question, you can just shoot me an email or you can text me. And patients are great about doing it so far. It really takes the stress off the families of like having to keep this running list of, oh, I need to talk to the pediatrician about this, but I need to wait till my well check. Like,
Yeah.
we kind of get rid of that. Also, what are some other things all the labs that we do. So we will do strep testing, flu testing, hemoglobin A1C and glucose, which are diabetes screeners. I have point of care cholesterol testing. We've got COVID. I mean, really any type of like just finger stick test, that's all completely included. So there's no additional cost for that at all. Great same day access here, obviously, because I don't have a panel of 2,000 patients I have to get in. If I cap it at 200, the odds of all 200 patients being sick at the same time is pretty slim. So,
yeah.
So, being able to work people in, I also, what's great for my members, this practice is like less than 5 minutes from my house. So if it's an evening and I'm home, it's 7:30, 8 o'clock, hey, something's going on with my kid. I think they have an ear infection. Great. Let's go meet at the office. Like, it's my office. I can open the doors and I can meet you there when we need to meet you there. If it's a weekend and we feel like we need to get you in, we can do it. Or at least you can pick up the phone and you can talk to me.
Yeah.
You're not having to talk to somebody who doesn't know your kid at all, which was also really hard on the other end. Like, as a physician, when you were on call and having to cover thousands of patients, and it's a terrible feeling when somebody calls you and they have a concern about your kid and nothing about that kid because you just don't take care of them on a regular basis. And a lot of us would be like, well, it sounds like you need to go to the ER and get that checked out, because we just didn't have any other options. So here we have better options, which is nice. I try to keep my kids out of the ER.
Yeah, I mean, that's amazing to think about, that families could have that mind shift from, I've got to like keep a running list of questions to save for this one visit once a year, to like, is it okay if I text her right now?
Yeah.
Right? So
yeah, and they do, and they know, like, it's so far with everybody, there's been no, like, I haven't felt overwhelmed. I remember somebody wanted an appointment the next day and they just went on my little calendar and scheduled one for the next day. And I actually reached out to her the night before and I was like, hey, I see you're coming in or you want to come in tomorrow? She's like, yeah, my daughter's sick, but it's not emergent. I'll just talk to you tomorrow. Like, she could have texted me to talk about it. She was like, it's okay. So, like, okay.
Aw.
So like I'm there when they need me, but I don't feel like, it's not overwhelming. I'm not getting unusual calls. There's no like, like abuse of the system in any way. Like they're legitimate phone calls and legitimate concerns, which are
Yeah,
good.
that's awesome.
Yeah. They're also the other thing that's really nice is discounted labs, which I didn't figure this out until I came into this side of the world. So there's, you can get relationships with the local lab companies instead of having to get a lab draw done like at a hospital,
Yep.
or kind of not processing insurance. And the labs can be significantly discounted. It's unreal. Like something that might cost like, $100 you get for like less than $5.
Huh.
It's wild. It's
Wow.
wild. I know, right? I know.
Yeah.
I'm like, what is happening? So you have the choice, and you have the choice where I can tell you, like, if we need to do a blood draw outside of my office,
Hmm.
which we can do blood draws here, but if the kid's really small, I'm going to recommend going out.
Hmm.
I'm not that professional, not that good. But I can tell you what the labs will cost before you walk out of here. Like, hey, if we don't process insurance and we just run my labs at my discounted fee, it's going to be $15.
Yep.
And then we can, talk to the insurance company and say, hey, if you run it through insurance, this is what it's going to be. You have the option. Which route do you want to take?
Hmm.
So it's kind of cool. Just a lot of transparency,
Wow.
which is
And
what people want.
exactly. I mean,
Yeah.
so can you talk a little bit more because I think right before we went live, we were talking about how DPC is a really great model for new moms.
Yes.
Talk about that. I mean,
Yeah. So and everybody's going to be a little different in
uh-huh.
their DPC practice and what they offer. So, specifically for me, like some DPC practices are strictly home visits only. There are
Oh,
some out there like that across the nation, just not here, where they literally every visit is a home visit and they just charge a little bit more. It's just a little different model.
yep.
They just didn't want to have the brick and mortar setup. So mine, newborns for the first 6 weeks, I actually will come to your home.
Oh,
So you don't have to load up your kids if you have other kids, or just load up in general. And trying to get out with a newborn is very challenging.
yes.
And you have so much stuff. And inevitably, you're not going to bring enough diapers. That's always happening. Always. So I come to you if you want me to. Some
Mhm.
people like to still come to the office. But if you want, I come to your house for those first 6 weeks for visits, which has been for some of my patients, I mean, just amazing. Such a godsend to not have to be out and about. And especially in the winter, I mean, I'm sure it's going to be even really nice to not have to go out in the cold. So that's huge for new moms. I think just in general, new moms have a lot of questions, as they should. They're
Mhm.
new moms.
Mhm.
They are going to be the ones who are calling for, their baby's got that fever for the very first time and scared and not know what to do. And it would be nice to talk to your doctor and talk to somebody who knows you and not have to be talking to a nurse or somebody else who's never met you before.
Mhm.
So that I think is definitely a big value.
Yeah, I love that. And especially like I mean my kids are 14 and 11, so we're way past that stage,
Yeah.
but I I just remember those days of like, oh my gosh, I left this because there was like a million other things he had to
Mm-hmm.
leave the house with. So, I think that's really cool. And thinking about like this shift during COVID and switching to telehealth, what I've loved is being able to see families in their own setting because it just is more
Yes.
natural. It's just, and I get to
Mm-hmm.
see a little bit more about the families that, I take care of. It's just a
Yeah.
special opportunity to be able to see them in their own house.
Yeah. We don't usually get to go to their
We
houses.
don't.
It's kind of fun.
Yeah, it is. And then you get to meet the dog or, get a tour of
Yeah.
their house.
It's nice for moms too, because I tell you, after having a baby, the last thing you want to do is like put on real clothes and try and go outside,
Yeah.
like, and do something. And two, if, dad has to go back to work, a lot of dads have to work. And if you don't have help, you shouldn't be carrying a car seat. Like, that's hard. And
Yeah.
so it just kind of helps alleviate a lot of those stressors, because mom had a baby too. Like, it's not just like this baby appears, like mom also went through stress. And so we have to acknowledge that as well.
Yeah, yeah. Well, the other question that I was gonna ask was, but I think we covered this, was about that health insurance piece. So
Yeah,
you
I do
know?
want to touch on that some though, because I think a great analogy and for people to understand what I tell people, I definitely recommend health insurance.
Hmm.
I now to each their own. Some people are like, I don't want health insurance, and that's fine. That is totally a personal decision. People do that now. You can have it or you don't have it. Don't have to have it. It's just a risk that you take. I think of it. I try to compare it to car insurance. So obviously, if you're in a car accident and you have car insurance, it's covered. Um, your oil changes and putting gas in your car insurance do not cover that. You have to pay for that. So I'm kind of like the oil changes and the gas. Like you pay for that. But if something bad were to happen, which we never want to happen, but if something catastrophic would happen and you would have to be in the hospital for a while, you want the health insurance there.
Yes,
Like
yes, for
I
sure.
can't do anything for that. And so it's getting a high deductible plan, obviously, because everything we do hopefully will be covered. And then if you ever go into the hospital, you're going to hit that deductible in about 1 to 2 days.
Hmm.
So getting that high deductible plan, I think is the best option if you're going to get the health insurance, which I recommend.
Yes, 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 for sure. Because rising healthcare costs and, costs of medications, things like that.
Yes.
So, yeah.
Yes. Oh, that
Well,
reminds me. So we do, and you said like what's included. So stuff that we do here, I do have some meds that I can dispense here, which is nice.
okay.
And I have breathing treatments in office here. Like I try and have a lot in here to avoid having to do anything in the outside world, really. I try and offer as much as I can out of this office. So
Yeah, no,
yeah,
that's great. That really is. And I mean, I've seen your office. It's beautiful. And
thank you.
you got
It's
to
very
kind
colorful.
I know, I love it. And it's kind of reminiscent of the painting behind you because you do have a
Yes,
beautiful mural in your waiting
yes.
area.
This
So,
painting is done by my mom,
oh,
actually.
really? Oh
Yeah, she
my gosh.
I wanted her to do the big wall, but she was a little nervous about it. But I convinced her to
Oh,
do this one behind me, which is gorgeous. And
it's
so
gorgeous.
they kind of mirror each other. The painter who did that one, she's a local
Uh-huh.
artist. And so she did the wall out there and I showed them the same, like it was like a wallpaper pattern. I was like, this is what I want it to look like. And they both made it happen.
Oh my gosh. And now that's so extra special. Look at
Yeah, it's
that.
very special.
Yeah.
It's beautiful.
It is. It is. And you know what? It sort of mirrors your personality. You're
Thank
colorful, you're
you.
bubbly. I just,
Thanks.
yeah. Well, so for those people who are watching this and are local, where can they find you?
Oh, yeah, that's probably
Yeah.
good. So I am you could probably explain this better than me. So I'm in the village of West Clay,
Hmm.
which the closest intersection, what would we say, like 100, what is that?
Like
31 and what do you think is the closest
I
intersection?
would say like 1/16th and town, sort of.
Yeah.
So that.
So
Hmm.
most people know where IU North is. IU
Yes.
North Hospital off of 31. We're about 5 minutes from there.
Yeah.
5 minutes, I think, northwest-ish. So I think that's right. But we're in the Carmel area and I'm right on like kind of a main stretch in the village of West Clay. So
Yep.
very easy to spot.
Yep.
Yeah.
Yeah. So, and then you have a website, right?
Yes, have a website. So that's just www.littlevillagepediatrics.com. And there's anything you could ever want to know is on there. The pricing, and we do big sibling discounts are huge and family max plans. So everything is on there, more about me and what I've done. And just pretty much everything that's offered in the office is on there too. So it just
Hmm.
has a lot more details, I guess.
Yes. And then your social media accounts tell them where to find you
Oh,
there.
yes. I have become very active in social media, which I'm not fantastic at. I'm getting better, so bear with me. But I've got Instagram.
Uh-huh.
So that is at Little Village Pediatrics. I tried to keep it very simple. And then Facebook also is just Little Village Pediatrics. I also just recently created a YouTube channel.
Uh-huh.
I cannot. You just have to search Little Village Pediatrics. I don't know the actual like website handle or anything, but on there. So every Monday, which some people on here are watching, have probably seen, I do a video. I try and do like an educational video. I try and keep it super short, like 4 to 6 minutes on some kind of hot topic that I think is beneficial. So I put all those videos, I've now uploaded them onto YouTube. So if somebody just wanted to go and watch the videos, they could go to that YouTube channel and watch them all. I've done so far like safe sunscreen ingredients, how to actually put sunscreen on. That's very important. Insect repellents, talked about mollusca, like all sorts of random stuff I talk about, and I try and pick something new. On Mondays, I do that. So
That's really fun. I mean, you're running a business. You're running a
I'm
business.
trying. I'm doing what I can and being a doctor at the same
Yeah,
time.
I know it. You're a physician entrepreneur. So welcome to the
Yes.
world of that.
Yeah.
I'm really proud
Thank
of
you.
you. I'm really proud of
Thank
you.
you so much. I
And I'm
appreciate it.
yeah, and I can see the enthusiasm and you're just happy and you get
Yes.
to just do what you want to do.
I just do what I want to do. I practice how I want to practice, how I think is best, what is
Uh-huh.
best for my patients, and I
Yep.
can just do it. And it's awesome.
Yeah. I
It's
mean,
pretty cool.
it is pretty cool. Yeah,
Yeah.
for sure. Well,
Yep.
so I have really enjoyed this time talking with you, Dr.
Thank
Davidson.
you. I have enjoyed this as well. Thank you.
And so, again, if you, I just wanted to share who my next guest is for next week. So let me just show that. So my next guest next week is Dr. Elena Shea, who will be talking to us about breastfeeding as well as literacy in early childhood. So please make sure to join me at 7:30 Thursday next week. And then for those of you who follow me, I also am doing a parenting book club. So again, Anxiety Relief for Kids. This is a awesome book. Those of you who know me, I love parenting books. I have so many of them. And again, I do want to say this is really practical. You can start implementing things right away. And that's part of the reason I chose it. And I'm going to announce that the author is going to do a Facebook Live with me July 9th
Mm.
at 6 p.m. So you can read along and then ask her questions. So that's a lot of fun. And it's free. So, just look at my website and you'll find details there. All right, so if you have suggestions for any other topics or guests, please feel free to reach out to me at letstalkkidshealth@gmail.com or drop me a comment below or message me anywhere on social media. And remember, consider subscribing to my YouTube channel, Narissa Bauer MD, to be alerted when I go live each week. And again, it was such a pleasure reconnecting and chatting with you, Dr.
Yes.
Davidson.
Thank
Thank
you.
you so much for joining the show. We'll talk soon.
All right.